Thank you, Mr. Chairman. I'm pleased to be here in Salt Lake City for the first time, and I want to thank our witnesses for sharing their expertise and their personal experiences on the topic of healthcare innovation and access. Under the Biden administration, we have seen significant barriers for Medicare beneficiaries' access to innovative technologies and bringing new drugs to the market. It can take up to 5 years after FDA approval for medical devices to get Medicare coverage. Innovative treatments see that same lag time. Further, the Democrats have made their intentions clear to oppose the pro-growth tax policies from the 2017 Trump tax cuts that have created a more competitive tax code. They've created millions of jobs. They've helped encourage and sustain innovation in the United States by giving businesses the tools to grow, conduct research and development, and reinvest back into their companies and employees and their communities. But even more concerning is the implementation of the so-called Inflation Reduction Act and the harmful impacts the Medicare drug price negotiations program will have on premiums and the development of critical life-saving drugs. Mr. Chairman, I would like to submit for the record a study by Milliman titled Expected Impact of Inflation Reduction Act Medicare Drug Price Negotiation Program on Medicare Part D beneficiary out-of-pocket costs.
Without objection.
According to the study, the IRA's government price setting scheme will cause Medicare beneficiaries' annual out-of-pocket costs to jump by $70 or 12% for those who utilize these negotiated drugs under Part D in 2026. Low-income beneficiaries' out-of-pocket costs will increase by a staggering 27%. And on top of the rise in premiums, the Congressional Budget Office's conservative estimates say that 13 fewer drugs will come to the market over the next 30 years, with outside experts projecting the number be around 135 new cures. I'll start with Mr. Wantawabi. Thank you for your mention of the impact that this will have on especially the orphan drugs, and I am also proud to be a co-sponsor of the Orphan Cures Act. The President said recently that the Democrats, quote, finally beat Medicare, unquote. And I'm afraid that the data in Medicare Part D would agree. My question is, do higher out-of-pocket costs lead to patients stopping treatment, perhaps, or maybe trying to ration their medication? What impact would this have as a whole?
There's no question that increased patient copays has an impact on patients adhering to therapy or even fulfilling therapy. I think it's well known in the biopharmaceutical industry that any time a patient is paying more than about $35 out of pocket, the rate at which the patient refuses to accept the medication at the pharmacy counter goes up. And that's leaving aside conversations between a doctor and a patient where the doctor says, hey, I'm going to prescribe this medication for you, but the copay is going to be X, and the patient walks away. And this, unfortunately, is occurring across both commercial and Medicare plans where there's constant increase in cost shifting to the patients, which is unfortunately impacting the standard of care.
And I see all your fellow witnesses nodding their heads that they're in agreement that this is a concern. I want to also talk about manufacturing and R&D. I recently introduced the Bipartisan Supply Chain Security and Growth Act, which will onshore critical supply chains in pharmaceuticals, in medical devices, and other manufacturing back to the United States by providing credits to companies who choose onshoring their manufacturing. Mr. Cullimore, can you speak to the importance of these types of incentives as we work to onshore these particular drug production and in particular reduce our reliance on foreign nations, communist China, which we unfortunately rely on far too much for APIs and other pharmaceuticals?
Thank you for the question. It's really important to understand that the reason people have gone to China and other places is because it's cheaper. Now, to bring them back, to reshore those kinds of processes, the investment of dollars to make that happen is significant. We just met with a company that was looking at doing the chemicals, the APIs as they call them, that they're doing overseas, bringing them here, acknowledging that it was going to be a significant investment. A bill like you're proposing would provide incentives and a pathway for those kinds of reshoring activities to occur. Because the biggest problem is not just the lower costs, it's the investment that it requires to reshore and do all of those kinds of things. So you're right on track with that.
Well, thank you very much. I appreciate that. And you know, we see shortages, about 250 different drug shortages, things like antibiotics and chemotherapies. We need to onshore this stuff. If COVID taught us anything, it is that we cannot rely on countries, particularly a communist country like China, for this. And so we, as a committee, are working very closely to try to address this issue, and hopefully we'll be able to do it in the near future.